Thank you for being here today. Fortunately, we have Dr. Mark Weisinger with us, and some of the things we want to discuss are um, why would you pick up the phone and call a lawyer if you've received a diagnosis of colon or rectal cancer? Maybe some examples of why you would pick up the phone and talk to a lawyer. So that's what we want to talk about today. And the first thing, doctor, that I've seen in the practice of law is in this area of colon and rectal cancer is when someone has bright red blood in their stool or dark brown blood in their stool or any type of blood in their stool. We'll see where a diagnosis of hemorrhoids has occurred and there really has been no follow-up to determine whether that bleeding was from colon or rectal cancer. So let's spend some time on that. Can you tell us a little bit about the medicine or the medical viewpoint when someone shows up in an emergency room, a primary care office, a urgent care, or any other medical provider and has some type of blood in their stool?
Well, that's actually a pretty common scenario, and it's quite unfortunate. That scenario where someone is told, well, your bleeding comes from hemorrhoids, and we're going to give you some cream or suppositories, and you can follow up with a regular doctor. That tends to occur more often in urgent care clinics and emergency rooms, where there's a lot of pressure to turn over patients quickly, and there may be a whole waiting room full of anxious people. But it comes from a mistaken conception that somehow or other you don't get free bleeding, you don't get bright red bleeding from a cancer. And cancers can occur anywhere from the anal verge up to the cecum, which is up and around your entire abdomen and over on the right side. Colorectal cancers are insidious because they don't tend to be symptomatic early on. And the guidelines for screening people for colon cancer are pretty well established. But unfortunately, a lot of physicians are either mistaken or they're too busy. And some of them actually are somewhat reluctant still to do rectal exams or even to recommend more invasive procedures like colonoscopy or barium enema to look for a potential tumor. And yes, that's a really unfortunate scenario, and I don't think that it's going to change until the public is better informed and start asking for a higher level of care, and until physicians are a little bit better informed themselves about what their colleagues are saying are the basic requirements of care.